All right, so we're talking about primitive reflexes today and the importance of having them when they're supposed to be there, and then the super importance of them not being there when they're not supposed to be there. So a primitive reflex is a reflex that an infant is born with to help them survive, because obviously as a newborn baby, they don't know where to find food or how to roll over or do many things. So a lot of reflexes you'll find, like if you brush on the side of a baby's cheek, they'll turn their head and try to find food. You can turn the head to one side and they'll make a little fencer position as well. Those are there to help the baby learn how to roll over later on in life. They're very important. They help develop different parts of our brainstem. They help develop different parts of our nervous system. But what happens is they're supposed to go away. They're supposed to run their course, and then at about anywhere from about 3 to 6 months, they're gone. The last one is the plantar reflex on the bottom of the foot. That one's usually gone by about 12 months once the child is walking. But what happens a lot of times is after a traumatic brain injury or a very stressful situation, an illness, these reflexes will start to come back to try to help reintegrate the nervous system. So it's trying to do a good job, but our cortex is already developed enough that we don't need those to fire. So what we're doing now, and we're really trying to find more with, is that the quicker we're able to get rid of these reflexes, the quicker the nervous system is able to go back to balance and back to its normal resting state. I found a research article the other day in the journal of Neuropsychiatry, and it talks about how like those primitive reflexes and peritonia, which is just inability to relax the muscles during like a muscle assessment, how they're present in a good majority of traumatic brain injuries, so our concussion patients and things like that. And so the reflexes, what we're trying to do is we're trying to extinguish them. We're trying to get the nervous system to not react when something brushes on their face or brushes on their back, or if they turn their head, their arms don't flex. If something touches their hand, they don't just all of a sudden grab it like an infant will do. And all of these things, as we get them to stop doing that, start to rebalance out that nervous system, get the brain back into balance, along with our other therapies and exercises and adjustments that we're doing in the office. But it helps bring that brain back into balance, back into homeostasis.